p.m. news. My name is Romeo Dingwan. I'll be a presenter for the news this evening, and I also have my associate in the field who goes by the name of Marielle, and she'll be assisting me in giving me facts about what's going on out there and so on and so forth. Today, we are going to be talking about herbal medicine. Um, it's come to a lot of our attention that herbal medicine is a growing thing that is taking over the world today. And we don't want to be ignorant about all of these things because they say knowledge is power. The more you know, the better for you. So, herbal medicine, herbal medicine, herbal medicine. What is herbal medicine? Some people call it herbalism. Some people call it herbal medicine. Whatever you call it, they all mean the same thing. Herbal medicine, herbalism, and what is all that? Herbal medicine is simply a traditional medical practice with the use of plants and herbs or extracts from plants and herbs. And today it's very common. It's like taken plants, the use of plants, the use of herbs have taken over our scientific industry when it comes to medicine because most of our medications are being made from these plants and these uh, herbs. So it is important that we know the importance of this herbal medicine. And what is this herbal medicine all about? Herbalism, the main proponents of herbalism or the main things uh, that make up herbalism are plants and herbs. We keep talking about plants and herbs because that's the main thing that's what herbalism is all about. Plants and herbs. You got plants, you got herbs, you mix them together, you know how to mix them, you know what to include in them, boom, you come up with something that has healing powers. That's what is happening in our world today. That's why many people don't go to the hospital, they don't use modern medicine, even though modern medicine is simply the chemical transformation of our plants and herbs into what we see as tablets today, or you can take it as a tablet or whatever. We also have like supplements, and that's what we use basically daily. You go to the gym, you see people that are going to the gym every day, you look at what they're taking, they tell you, oh, I'm taking this supplement, it's mainly made up of so and so plant, and you begin to wonder like, oh damn, these plants, what are all these plants? These plants literally they have so many different things that they produce and they make in our life, and it's so important that we understand. And these plants are so vast in the world, they are like so far apart, not far apart, but they're everywhere in nature. That's something about these plants that is very important because they're in abundant supply. you know you don't have to like stress too much to find these plants. As long as you know what you're looking for, you'll be able to understand where to find it. And the reason why there's so many of these plants is because um, of the variety of these plants is as a result of the different climatic zones that we have. It is said that there are actually 16 agroclimatic zones in the world. Can you believe that? And not just that, we also have 10 vegetative zones with 15 biotic provinces. That's a lot. That should bring about a lot of variety in plants. And knowing all of that, if you understand what agroclimatic zones are, vegetative zones are, biotic provinces are, you understand we're not just talking about a little piece of land, we're talking about thousands and hundreds of thousands and millions of kilometers of hectares of land. And that's a very big thing if you come to think of it. Today, we're going to be looking at the purpose of using herbal medicine, and it is important that we have a case study. Today, our case study is going to concentrate on the Mission tribes. And who are these people, the Mission tribes? I mean, do you know who Mission tribes are? Oh, well, I don't think I know. This is my first time hearing about it when I was, you know, doing research for this. But the Mission tribes, like I heard or like I found out, a small group of people that live in the Asama region. And where is the Asama region? I know some of you be wondering where the Asama region is. I'm going to tell you honestly, I didn't know myself at first, but don't worry, I got you. Now we know. The Asama region is simply, the Asama region is in India. It's little part of southern India, and it's very important to know because these mission people, their main source of living is agriculture. And when you hear agriculture, you start thinking about farming. When you start thinking about farming, the next thing that comes to your mind, plants. When you hear plants, you start thinking about plants. You're talking about healing. Boom. What do we have? Herbalism, herbal medicine. Mission people, agriculture, their main and source of livelihood. They do a lot of farming, so it's very obvious that, and they live in the bushes, so that should already give you an understanding that these people are not part of our modern society, as in that the technological know-how that we have in modern society today hasn't reached these people, and it's not a bad thing, but obviously they haven't had the chance to experience this modern technology. But one thing for sure that is peculiar about them is their farming, is their agricultural livelihood, which has to do with all the plants and herbs that we're talking about. And these plants and herbs have healing powers. So they've worked with them for so long, so much so that they already know how to mix them, how to cultivate them, which one to use and which one not to use. And because of this, they're able to live in harmony because they don't need modern medicine because they can produce their own medicine naturally from all these plants and herbs. And from that, after having known that, we're going to go to the cures and treatment. And this is good. I'm going to give it, transfer the news to my associate Mario to take over so we can listen to and know some cures and treatment of herbal medicine. Thank you.
Thank you, Romeo, for such a wonderful introduction. Very informative. I hope everybody learned some new facts. So, today I will be going in my segment over the cures and treatments of herbal medicine. So as you can see, I have broken it up into different diseases and disorders that you can use herbal medicine and specific herbs for the treatment of these specific diseases and disorders. So we're going to start off with the cardiovascular system and diseases of that system. So a very prevalent problem in America, especially with our very high obesity rate, is high blood pressure, also known as hypertension. So there are some specific herbs that you can use in lowering your blood pressure. Some examples are garlic, ginger, cardamom, and cardamom actually is specific, or sorry, special because it also has the ability to lower your risk of blood clots. And this is significant if you are at a higher risk of, developing blood clots. And yeah, so it's a two-in-one package. There's also another two-in-one package in the herbs that help with lowering your cholesterol levels. So we're going to move down to high cholesterol. So people do use cinnamon and curcumin to lower there's good and there's bad cholesterol. So it's important to differentiate that. So this is for lowering your bad cholesterol levels. And so cinnamon also has the two-in-one package trait. And so it also does lower your blood sugar, which is important. And so we're going to move over to mental health disorders. So there's depression, and this is actually a big one. So people who do have depression, there has been studies that show that using St. John's wort is effective in treating depression. So speak to your doctor and see if that's something that you guys can, work towards incorporating into your lifestyle. And then there's also anxiety. So some herbs are passion flower, chamomile, and valerian. I've heard of chamomile tea. I know that it does help calm me down, so you can always use that. Just take a cup of chamomile tea, drink it at the end of your day, relax. But also it's important, these do have, some good effects, but it is important to talk to your doctor to make sure that it is, safe for you. Everybody's different, so just, have that chat. Okay, so let's see. So we're going to go into women's health. So there are some herbs that help with women's health, with menstrual pain, some other problems that do affect women and the reproductive system. So there's black cohosh, there's evening primrose, there's feverfew. So if you do have, really strong menstrual pain and cramps and stuff, so talk to your doctor and see if that's something that will help you and be beneficial for you. Um, there's the immune system, there's echinacea, there's golden seal, and there's elderberry that can help with boosting your immunity, especially now that we're in a pandemic that cannot be hurtful to you. So also speak to your physician and see if that's something that's a right fit for you. Then there's also brain health, there's ginkgo, there's biloba, ginseng, and butterbur. These do help with your cognitive performance. So if you're feeling sluggy, look and see if this is something that will be helpful for you. Okay, so just the important thing about herbal medicine is that you want to make sure that you're aware of its limitations. It's important to know that you're not supposed to take it and just stop going to the doctor. It's obviously really important to go get your annual checkups, go speak to your doctor if you feel as if there's something wrong with you. Of course, if you're experiencing certain things and you think you should go to the ER, don't take that cup of chamomile tea and drink it and think that'll help. Go to the ER. That's also really important. Beware of advice that hasn't been regulated or fact checked. That's very important. You can put anything on the internet these days. You don't want to ingest something just because, Lover 2409 said, yes, it's okay to take it. Talk to your physician. Talk to somebody who has this experience and has the education, and make sure that it is safe. So herbal medicine is a practice that it's been used for health promotion and treatment, and it's not only for cures. Or the treatment of potentially fatal diseases. So this does go back to if you feel wonky, if you feel off, go to the ER. Make sure that you're taking those necessary precautions to making sure that you are healthy and safe. So make sure that you talk to your doctor, your physician, your healthcare provider, nurse practitioner, whoever, and make sure that it's safe for you. Like I said, everybody's different, everybody's body's different, everybody has a different reaction to different things. Make sure that it's safe for you. Make sure that it won't interact with other drugs that you've been prescribed. If you go to the doctor, they ask you what other, medications have you been prescribed? What else are you taking? And this is important to know that there may not, or they may be interactions with, these herbs and these drugs. So definitely bring that up to your doctor if you are starting a new herbal supplement, especially. Um, and then you should check the efficacy and what amount has been deemed safe. You don't want to, ingest too much and then have these terrible side effects. So that's also important when you are starting to get into herbal medicine. Okay, so herbs have been used for health promotion since the beginning of time, since there's actually been studies and evidence that this has been a practice that can go back to the ancient times. So it's still widely used across the world. Actually, there has been a study that shows that around 80% of the world's population does use herbal medicine, which is fascinating. Herbal medicine and herbs do play a large role in commercial medications that are out today. And herbal medicine does have its pros and cons, just like anything else. But it's really important that you make sure that it's beneficial for you, it's safe for you. So have these necessary conversations with your physicians, and just make sure that it's the right fit for you. So thank you so much for coming to Romy and I segment. I hope you learned so much. If you think that this is right for you, of course, talk to your physician, talk to your nurse practitioner, your healthcare provider, whoever you see, and just, try it out. Thank you so much. Have a great rest of your day.